is Celina Earl, and I did my placement at the Syncrude Center for Motion and Balance located in the Glenrose Rehabilitation Hospital in Edmonton. It is a motion and gait lab that uses a multidisciplinary team of kinesiologists, physical therapists, physiatrists, and orthopedic surgeons to help increase function, comfort, and efficiency of gait for a variety of patients who have motion disorders. During my placement, I learned a lot of new skills, such as how to collect and analyze petabarograph data, how to calibrate and clinically apply a motion capture system, how to precisely apply surface EMG markers for accurate data collection, and how to process and analyze motion capture data using a visual 3D biomechanical analysis tool. The latter three skills prepared me to complete my special project. For my project, I developed a novel template that the Syncrude Center could use to analyze a squat motion. I chose this project because many of the patients that come to the gait lab are undergoing strengthening physical therapy regimens, and I thought that it would be beneficial to provide a means of measuring strength development and treatment outcomes. The Syncrude Center currently has a template developed to analyze gait, which is pictured here. The gray lines represent normal or average motion during gait, and the colored lines represent the patient's actual motion, which is then compared to the normative data. The end objective of this project was to build a squat template like this that was usable and familiar within the gait lab. To complete this project, my plan was to first collect kinematic, kinetic, and EMG data from several people using motion capture by the first week of July, then to analyze, model, and process this data using the V3D motion analysis software, and then to use this data analysis to create a template in Microsoft Excel by early August. Since I was learning the V3D program for the first time, I ran into a lot of technological issues. For example, in many trials, the orientation of the skeletal model that I created with respect to the lab around it was incorrect within the program, which would make my graphs look like this. And it was disheartening spending so much time creating commands and models within this program and processing data only to have the graphs turn out to be inaccurate. But to deal with this, I devoted time to learning how to diagnose these errors so that the outcome of the project was a template that was accurate every time new motion data was entered into the V3D system. Furthermore, due to COVID and Alberta Health Services confidentiality agreements, I was not able to collect data from enough people to create a normative dataset, so I had to adjust my focus away from data collection and more towards perfecting this template with a smaller dataset. I think that due to the challenges I experienced, this project helped me develop conscientious work habits, as well as develop my resiliency, which further applies to dealing with stress, workplace conflict, and other job-related challenges. This project also helped me to develop an array of technical skills such as a better understanding of squat mechanics, improved Excel and information processing proficiency, as well as a better understanding of functional anatomy. Overall, this project was successful and the template works. It has value in the Syncrude Center as a novel way to assess the outcomes of strengthening physical therapy programs. Developing ways to improve patient care is always valuable, and this is the overall impact the project has on the Syncrude Center moving forward.